focus on chronic fatigue-associated conditions. For the most part, it's called chronic fatigue syndrome or CFIDS, so chronic fatigue immune dysfunction syndrome. It's also called in most of the world ME, myalgic encephalomyelitis, fibromyalgia, Lyme disease and related co-infections. We also focus on environmentally acquired toxicity that leads to a chronic disease. We focus on mold illness. Unfortunately, that is a very, very significant priority in the US and in the first world. We focus also on other environmentally acquired illness, from industrial exposure to chemical solvents. We focus on people with implant illness. Probably the most common, unfortunately, is breast implant illness, where ladies react to the silicone either in the shell or the envelope. So even if it's saline implants, the silicone in the envelope tends to cause problems in a few different ways. And then of course the silicone gel-filled silicone bags are sometimes quite impactful on someone's health. We focus on approaching the diagnostic process in several different ways. No single diagnostic approach is fallible, so in trying to get the best understanding of what it is that is holding someone back from regaining their health and healing, we superimpose several different approaches. So number one, we do a very thorough case intake where we look at someone's timeline, which could be exposures from their being in utero, childhood, adolescence. Occupational exposures are very significant in our patient base, and follow that up also with events that could have been impactful. Psycho-emotional exposures, losing a loved one, grief, other emotional traumas are very impactful on people's ability to be able to regain health and get better or not. We focus a lot on the inevitable microbial and chronic infectious component. In this technological day and age that we're living, environmental toxins that are mostly man-made, industrial toxins, agricultural toxins, play a huge role in chronic illness these days. The unfortunate reality is that a lot of these toxins are fat-soluble, and they literally dissolve into the body, into the fatty membranes of the cell, and most certainly into the central nervous system, which for the most part is composed of fat. So in putting together a multi-etiological picture, we do a really thorough job. As far as the physical exam component of the intake and follow-ups goes, I've put together a very specific physical exam that really helps us get to the bottom of some of the most important things that chronic disease presents with, that is detectable to the physician with an inquisitive mind. Treatment is specifically tailored to both the factors that we find are problems in someone's either falling ill or staying ill, and these could be focused on microbial, parasitic toxicities, but also we pay great attention to prioritizing a hierarchy of what should we go after first. So structuring our treatment process on the timeline, it sometimes makes the difference between failure and success. You know, in chronic disease, you often hear of people getting so sick from treatment and taking literally a shopping basket full of supplements and drugs and not really getting anywhere. And when you really work that case and you look at structuring the data and prioritizing the findings and then structuring it in a very deliberate and resolute way on the timeline, that's where you get progress, because you do things in a way that is not just doable in the moment, but it's sustainable over time, so that with a structured and disciplined course of care, you can unravel chronic disease. The treatment almost always has different components. So In my mind, I see that there's two columns of responsibility. I'm good at helping patients understand what is in their column of responsibility. In other words, these are factors that they have some to total control over. And this entails the type of food they eat, managing their sleep hours. If somebody has psycho-emotional or inner self-talk problems, I connect them with relevant medical professionals that can help them and guide them to redesign their inner life process so that their inner life process is not stressful, that it's satisfactory. And then there's diet, lifestyle, relational stress that can impact chronic disease, and it literally can be a pivot point whether you heal or not. A problem that unfortunately so many of our patients face is that the homes that they live in are not healthy indoors environments. Some homes have a disproportionately high amount of VOCs, so volatile organic compounds, formaldehyde that comes from solvents, glues, adhesives, and this is the off-gassing from carpets, paints, new furniture that can be absolutely disastrous as far as one's health and be a determining factor in whether somebody gets better or not. The way that our homes are built in the USA, unfortunately, homes are prone to become moldy, and the products of mold growth and metabolism are mold spores, hyphae, and then very focused on, in my world, mold toxins. If somebody lives in a home that has higher than tolerable mold and other microbial growth products, it is very strongly associated with causing fatigue and inflammation associated conditions. So those are the things that patients are responsible for with guidance at all times. My column of responsibility is to take care of, in a very thorough manner, putting together the components that contribute to them having fallen ill or staying ill, that require microbial focus. So antimicrobial therapy is usually in my column of responsibility. There's a significant focus on environmental toxins and mold toxins, bacterial toxins that can dissolve into and to some degree saturate the tissues, which prevents normal function. The treatment process is usually balanced between oral treatments and then also in-clinic intravenous treatments that seem to be disproportionately effective at helping to undo the effects of the infections, inflammagens, environmental and industrial toxins. We individualize treatments for every single patient based on the work that we do to determine what the priorities are to help them get better. There's always an oral protocol that provides people with the nutrients that their bodies need to detoxify, to repair, and to start making energy again. In many cases, we also recommend that patients do intravenous treatments. Those are done here in our clinic, and this also is very strongly focused on especially the detoxification part, where we focus on getting the industrial, agricultural, and other chemicals that are dissolved into people's bodies out of their bodies in a much more efficient way as compared to the oral treatment. In order to remove these toxins that we mobilize with the intravenous treatments from patients' bodies, we also offer colonic hydrotherapy, which helps remove the toxins from patients' bodies in a much more effective way. Once people achieve a satisfactory level of health and they're feeling better, they resume their normal life. And for some people, it means that they go back to a clean environment, they eat healthy food, and they stay better. For others, they return to work. Is it in an urban environment? We must take responsibility for the effects of time in your own environment and the impact that it may have on your cells and thus on your health. So we have a verbal agreement once somebody graduates from treatment and they've achieved their health goals to at least return for further testing so that we may study the effects of a year or two in their life, in their house, in their job, on their cellular health and cellular environment. So there's absolutely the expectation that once patients graduate from treatment, that we do need to follow up with ensuring that they stay well and that we understand what the passage of time in their life and environment means for their health. The way that we approach our responsibilities to our patients is that I see that on the timeline we offer a course of diagnostics, a course of care to achieve the more immediate and more pressing healthcare needs. Once patients are satisfied with their improvement, we follow that up with a course of maintenance. And this is a more long-standing relationship where we're accessible to patients. We support them in investigating. We follow up with testing at appropriate intervals depending on their situations. For patients with infectious conditions, it's really important to follow up at intervals to ensure that the microbial infections remain dormant. And for the more environmental and toxicity patients, it's very important to do follow-up studies at appropriate intervals to ensure that we understand what the passage of time means in their life.